Good morning, everybody, and you're very welcome to our webinar this morning. Um, this webinar is a PCRN webinar, and this forms part of the Palliative Care Research Network webinar series. These are relatively small group events to allow colleagues to share their research and expertise on research topics on an area of interest. Just to let you know, the webinars are recorded and they'll be available on the Palliative Professional. A question and answer session will not be recorded. Just to let everybody know, we're going to stop the recording after the presentation. If you'd like to enable captions, please do so at the bottom of the screen. We would like to keep yourselves on mute during the presentations and rename yourselves so that everyone can see your name. We'll turn your cameras off for the presentation if possible, and if we could like to turn them on again for the Q&A, and we'll stop the screen share so that everyone can see each other. Topic of this morning's webinar is building successful collaborations in palliative care research. I'm joined this morning by Professor Kevin Brazil, Queen's University, Belfast. I'm going to give Kevin a very quick introduction and we're going to jump into the webinar. Just to give you a little bit of background, the focus of Professor Brazil's research is to assess and promote quality care for family carers and patients as they near the end of life. His research focuses on the structure, processes, and outcomes in service delivery. And as part of this work, he examines how personal, social, and environmental factors affect care. This work is designed to assist in the development, evaluation, and translation of new and innovative interventions to improve access, quality, and outcomes in the population. So that is a very short introduction for Professor Kevin Brazil. He has a much longer biography and CV. We're going to jump into things at the moment. So let me just move along my slides here. And Kevin, are you there this morning?
I
Do you want to say hello to everybody?
I am here. Good morning, everyone. And it's a real pleasure to meet everyone and see everybody here. What makes me nervous is there's a number of people who I know quite well who've joined us. So that sort of edges up the excitement for me and puts the pressure on me in terms of doing the best I can. So pleasure to be here.
Great, that's fabulous, Kevin. We're delighted to have you. So this what everyone can see on their screen at the moment. This is going to be the basis of our first question. So this is from the Queen's website, and this is a visual representation of all of the networks that you're involved in at the moment, Kevin. Now, to preface this is just Queen's. You know, there is more. It is bigger. It is broader. This is from 2012 onwards. But just to use it as a jumping in point, could you tell us a little bit about yourself, your training experiences that have led you to where you are now in the center of this map?
Okay, thank you very much. You know, this is, I mean, this diagram which you're looking at is kind of what's called social network analysis, and it does. I arrived here at Queen's in 2012, and this network analysis really is sort of a QUB-centric perspective of the web of relationships that I have, and doesn't recognize I guess, the web of relationships that span over into Canada prior to coming here. So that's a caveat, but it's interesting. It's an interesting graph or figure, just the same. But in regards to myself, well, what's quite often when I introduce myself to individuals in a professional fashion, I say I'm a professor of palliative care, but then I'm very quick to add that I'm not a clinician, I'm a social scientist. And behind that, my training, academic training is that of a social scientist with a master's and undergraduate in psychology, and actually a PhD in education in what was then called the Department of Measurement, Evaluation, Computer Applications, where my particular focus was in program evaluation. And when I completed my PhD, I ended up in Kingston, Ontario, tied into what was called the Regional Geriatric Program, and I had an appointment in the Department of Community Health and Epidemiology. And that was actually, I guess, my first experience of boundary spanning, in the sense that trained as a social scientist, and I needed to change my language to mesh or fit within a health science culture. And even in terms of how you express research design, such as the whole language of research and research design and practice is different in the whole social science context, and from that in the health sciences. So that from sort of training the social sciences and transitioning to health sciences was in many respects learning a new language of expression in terms of the work you do. So from program evaluation, I framed it as health services research, and then I expanded that to the notion of health systems level research. From the Kingston situation, I was sort of recruited to Hamilton, Ontario, where I led an initiative called the St. I was, I guess you could describe the founding director of something called the St. Joseph's Health System Research Network, which but also had an appointment in the Department of Clinical Epidemiology and Biostatistics, which some of you may recognize as the home of the expression evidence-based medicine, which we now call evidence-informed practice. And again, I was the subspecialty or arm in that department was health research methodology. So I was sort of framed as a research methodologist. And what happened with that type of kind of perceived expertise, if you will, is that I was drawn into a variety of research projects and issues that were broadband. So at one point, I was working with folks in Connecticut with the NIHR looking at asthma. Then it ranged to cancer care, respiratory infection, infectious diseases. So being a research methodologist, as opposed to, academia, universities, as we know, is very much encouraging deep specialization, and as kind of a narrow band is what we're encouraged to do, and which has its benefits and disadvantages. But being framed as a health research methodology was more broadband. And what transpired there, in terms of my own practice, is once again, having made the transition into health, I guess the health sciences, is also you had to become a quick study in various practice domains, whether it's in asthma, infectious disease, cancer, aged care, and so on. You were exposed to not only a different substantive area, but also a collection of individuals who were dedicated to that particular field. And you had to do a quick study of the substance area, but what you brought to the table was methodological expertise, which was boundary spanning. And so, but I guess the transition from social sciences to health sciences, and then while I was at McMaster, the sort of really sort of moving across different research groups within that practice environment, really the outcome was you lost your disciplinary background. So people say, I was off, who are you, what department do you associate with, et cetera. And I was actually didn't have the ability to respond. I saw myself as a health service researcher, full stop, and I didn't affiliate or align myself with, say, psychology, sociology, or education. And I think that so it was kind of, in some respects, was it in the early stages of my practice was a little sort of, I was caught short for it. I felt that there was something lacking within my own description, that I didn't have that label or deep specialization where I could hang my head or hat, I should say. But I think it worked out all right. So that's some of the background in terms of what I guess shaped the current practice. And of course, within McMaster, I was affiliated in the Department of Family Medicine and began to find that deep specialization in end-of-life care, where I was appointed to the Division of Palliative Care at McMaster and started to sort of focus my own personal interests within end-of-life palliative care. Does that help, Jane?
Absolutely does. And just thank you for getting so much detail in there, Kevin. And as a fellow social scientist working in healthcare and healthcare research, it's a fascinating the breadth of skills that you were able to bring along with you. And our next question there is on starting collaboration. So my next question to you is, do you think that adaptability that you learned in that transition from the social sciences into health services research, do you think that assisted you in starting collaborations? Could you give an example of of starting a collaboration? How do you pick a jumping off point?
How do you do that?
Mhm.
It's well, I think yes. I think I guess what's what are the personality attributes? Maybe the question could be what is it? What are the personality attributes which can make for somebody who is effective in, say, interdisciplinary research, which who's comfortable in terms of when we're talking about collaborations. Typically, what we're talking about is engaging in an activity, in this case, research, where we're working with researchers at the individual level. It could be across organizations, institutions, and communities, whether those communities are sort of the public side of things or the private side of things, where there's a sharing of expertise and resources for a common output. And more often than not, how I've witnessed this notion of collaborations is really from an interdisciplinary perspective, where you are working with people, say in the university, you're walking outside your department, and you're talking to somebody in different other alternate departments, whether it's economics or med sciences and so on. And I think, is there certain personality attributes that kind of facilitate the individuals to make those crosswalks? And it could be, a tolerance for ambiguity, because you don't know quite who you're going to be talking to or what the outcome is. So there can be a bit of risk taking there, that maybe when we're talking about sort of fostering collaboration or collaborative practice, we need individuals to be comfortable with ambiguity. That you don't know where this is going to go. But it's worth having a conversation with that individual and see if there's a fit there, in whatever form or fashion it may be. The that Also, there is tolerance for ambiguity may be a key piece to it. So I think there could be, I guess the question, maybe this is something, I think we're going to do a bit of Q&A further down the road, is the question is, are there certain personality attributes that can facilitate, within an individual, that can make this collaborative journey easier or harder, you know?
Yeah.
That's an interesting piece. But in terms of starting collaborations, I mean, there's a variety of ways. I mean, they're all so idiosyncratic, and it could be your own walking, sort of going to a conference, and you're following somebody in the literature who you're interested in. You go to, and you're sort of in the same community, if you will, and you find the opportunity to, you can actually reach out via cold call, which would be an email, or it could be sort of attending a symposium where they're presenting and sort of having a word with them after the seminar. It could also be that's sort of self-initiative. But also, there's this notion that certainly for junior investigators, but also sort of emergent or is investigators or researchers, that you have mentors, who can sort of signpost you in a particular direction, in terms of who you should be talking to and why you should be talking to, and what you may want to get out of sort of linking into that individual with the conversation. So there's being self-propelled. There's, sort of the role of a sort of a kind of a collegial circle that you may be embedded in. Certainly for postdocs and PhD students, that would be your supervisory committee and so on. At a more mature level, it could be just your immediate circle of colleagues, who not only sort of identify an individual who may have resonate from a substantive perspective, but also resonate on a personality level. Because usually that these individuals will vouch for that person, that they're approachable, they're supportive, they're collegial, they deliver, so there, it's not just the substantive area which you have to be sensitive to, it's also the characteristics of the individual, so that they do engaging in with this person or persons. And I guess a lot of the conversation we're having now is really, it's this idea of interpersonal relationships, or this notion about it's all about relationships. It's sort of vetting that individual with respect to their who they are. Um,
Yeah. Yeah,
don't know if
I
I.
think that's really interesting, Kevin. I mean, there's so much, there's so much there to think about, and leads us really nicely into our next question. This is a photograph from our last PCRN symposium. It's dormant in Belfast, and I use this picture. There's an awful lot of people in this picture from different backgrounds. So we have PCRN members, and we have ECRF members, it's our Early Career Researcher Forum. We have PPI representatives from our Voices for Care group. And the question really is, can you give us an example of a time that you had to bring people along with you in a collaboration?
Right. Well, I think the one of the things, I guess, the best example of that would be the experience I had sort of leading or directing the St. Joseph's Health System Research Network, and that was at its time an innovation where there was the St. Joseph's Health System in southeastern Ontario, and it consisted of 4 hospitals, 1 teaching hospital, 3 community hospitals, 2 nursing homes, and a visiting nursing organizations. And they were located in 3 different cities in southwest Western Ontario, which were about an hour's drive from each other. Anyways, this consortium of healthcare facilities felt that it would be a good idea to invest in supporting research, and to support research that really sort of addressed that offered a need-based approach in terms of researchers that would be responsive to the information needs of the practitioners in those organizations, or what would be described as a demand-side research agenda, as opposed to a supply-side research agenda where the researchers generate the research. So I was brought into that, and to lead that initiative. And there were approximately, I think, 4 to 5 PhD level researchers working with me, and we developed a model where an optimal model of working with these organizations, where in terms of sort of regular funding from the foundations associated with those organizations, setting up advisory committees in those organizations so that we'd have a sort of interaction between the researchers and also the administrative practice community in those organizations. Uh, what we really did is we followed something like a process where clinicians and researchers would identified what the common interests were. They sort of determined what the collaborative fit would be, identify the subsequent resources required, and implement. So it was an ongoing interactive process between sort of the practice community or administrative community and the research community. And that in terms of developing research activities that promoted an evidence-informed culture or practice within that organization. In terms of bringing those organizations along, one of the first things which we did is we actually developed workshops in terms of and ran them through the environment, and we targeted everybody from frontline staff to support staff, as well as administrators. And the workshops were around what is research. And the whole idea was that, what's the relationship between sort of a clinical or practice observation, engaging in research, and coming up with a solution. So the whole idea was to demystify research, and really to highlight that this is something, the research process, that kind of critical inquiry can be integrated in day-to-day practice in some form or fashion. So that was what we did within the St. Joseph's Health System Research Network, was meshing the research enterprise within that organization. However, we were also tied into the academy. So we had to sort of, we had appointments in, I think maybe 2, maybe 3 different universities at that time: McMaster, Waterloo, and Wilfrid Laurier. And so the appointees also had to negotiate with department heads their portfolio, so that they were sort of fulfilling the mandate of their sponsors at the organizational level, but also the requirements for acceptable performance within the academic departments as well. So it was always a balancing act in terms of what you could describe as conducting little r research in the organizations and developing big R research portfolios that are sort of sought after by the academy. And it was a continual balancing act in terms of orienting, educating that leadership in the university about the raison d'etre of the research network. So that's an example, and it was an ongoing process of engagement. And I think in that ongoing process of engagement and recognizing it's a balancing act, sometimes you get it right, sometimes you get it wrong. And if you get it wrong, is recognizing that you got it wrong and quickly sort of correcting and learning from that and moving forward. So, when things do not
Well,
go to plan.
this is it. You slightly preempted me there, Kevin, and I just thank you very much for that example. It's illuminative in terms of the different dimensions of collaboration and also your final point there about it being ongoing. It's not just once, it's ongoing through the program or the project. It does strike me, how would you manage things then when things go to plan? I imagine with so many moving parts that, in an ideal world, it's all going to run very smoothly and the relationships are going to all run very well. But would you have any sort of insight there from your experience about when things don't go to plan? What would be your top tips?
Well, I suppose it is what are the potential, where can it go wrong is recognizing where it can go wrong. So it could, it can work around, bad collaborations could be with your research colleagues when colleagues do not meet their work commitments, both in terms of delivery or quality. It's also disputes around credit and recognizing credit, problems related to disagreements about who should receive what type of credit. There can be personality clashes within the research team. There can be perceptions of some individuals are more selfish than others in terms of being self-serving. And, classic is ghost authorship, where individuals may insist on authorship, but have little or no contribution to the process. Um, there can be exploitation within the team. And also, and I guess in sort of the narrative which I shared earlier, is that institutions, organizations may have clash and may have different expectations. And the example which I shared with you is the academy versus sort of healthcare, sort of service delivery organizations. Different expectations in terms of what that individual should be doing and how does that individual balance them out. So those are some of the things that can go wrong and do present themselves. And I think to sort of navigate that is you have to be proactive. You have to anticipate what those problems may be. Some of the larger projects that I've been involved in, we have, and these would speak to some of the Horizon groups that I've been participating in. They usually develop an elaborate infrastructure with a number of a number of sort of mechanisms, but it really does speak to establishing clear objectives, and understandings amongst the players, being upfront about what that will be. Don't let ambiguity rest for a prolonged sort of period of time. Developing collaborative agreements, that typically happens at the institutional level. So I think you need to really, I think a key piece is also fostering trust within the players, and that's one of the things. Like when you were talking about how do you make these connections, is that when you reach out and you meet individuals, you should start small. You develop. It's really, once again, it's all about relationships, and it's a trust factor. Familiarity and trust really is, I think, a foundational piece in terms of collaborations and the ultimate success of an initiative. So it's planning these challenges proactively. It's also behind that is also setting up sort of I guess really good communication systems so that you're meeting on a regular basis, so there's no ambiguity in terms of expectations and people don't drift and timelines fall. And also, planning ahead. Some of the Horizon grants that I've been involved in is that you start early in terms you plan for publication and publications and the type of recognition within those sort of publications. So the developing, sort of authorship guidelines, who should be entitled, what's the criteria that an individual should meet to be considered appropriate as an author. And also unfortunately, the journals themselves are directive that as well. They now sort of specify what are the key criteria. So, and some of the consortiums that I've been involved in will have separate publication committees where they will sort of map out, people would submit their publication ideas, and there has been what we've done is identified data elements that will go into those particular publications. So the idea there is you're avoiding duplication, or where sort of team members bump into each other. So you have a clear sort of grid in terms of proposed publications, data that goes into those publications, who are the individuals who will be sort of writing that particular manuscript up. So that's quite elaborate. And I think what you do, if that's kind of sort of the gold standard, if you will, within a Horizon grant, you scale it down to size when you're talking about small teams, and being pragmatic about that, taking the next big step. Are we there already?
We're certainly a step by step, Kevin, a step by step. This is really interesting there, and again, I suppose what's really striking about your answers there is your approach to transparency and communication and honesty, and having that as a sort of a principle, perhaps to guide you through collaboration and developing and maintaining relationships. And I suppose bearing that in mind, the next question is around taking the next big step. So you mentioned there the EU Horizon grants.
Yeah.
So you have lots of experience there, and I suppose from your experience, could you give us an example of when you took a big step, perhaps from national to international? What top tips would you have for someone sitting in the audience today who's interested in perhaps taking the next big step themselves?
Well, I guess it's like the stepwise ladder, isn't it? I mean, I think the first, before it's sort of transitioning from a national to an international, the whole idea is start small. And starting small can be simply contacting individuals, identifying potential collaborators, and it could be sort of organizing a seminar. It could be organizing sort of an edited edition. So it doesn't need to be the grant. It could be sort of identifying those individuals who similar interests, who are like-minded, who are and then cultivating, initiating that contract, or not that contact under that heading, and then establishing shared values and goals, building trust, and relationships will subsequently develop. And those, what's interesting about the community you work in, these relationships actually they last for years. And like some of these projects that I've been involved in are 5 years long, and you witness births, you witnesses marriages, divorces. Like, this is a long story, and these relationships can go from one horizon to the next. So, but the key piece, is to start small and to grow it. And if we think that the foundational piece is around trust, shared values, and goals, and I think these things, these relationships tend to grow. And some of the experiences that I've had is I've worked, so for example, I'm on sort of a In Touch study, which is actually led by our colleague Nicola and Suzanne Timmons, which is a Horizon piece. But there's a history preceding that. A lot of the players in that consortium were individuals who we had worked together in a prior sort of project called My Support, and we transitioned to the next stage. And prior to My Support, there was other smaller national, pre-transnationals involving the same players. So what we're talking about is, long-term relationships that have grown over time. The foundation is trust, and and there's also an individual developmental process as you move from assistant to associate to full professorship, and with that comes a scale of the work that you're involved in, and you bring your colleagues with you, and that type of perception of how these teams work and how they develop can very well be a short circuit to addressing a lot of those bad collaboration experiences. Was that clear?
It was, and I think it was very, very interesting, and what's coming across there in your answer is also, taking a long-term view, starting small, and also a large heap of patience. It strikes me, Kevin, that is needed, and that perhaps, people, if they're thinking about the next big step, have to be mindful of that.
Very true.
You
And it
mentioned,
was interesting. It was described to me one time that individual researchers are really individuals who are into delayed gratification. We don't go for the quick buzz or jolt. We we play out the long game. You know.
this is it. Just feels perhaps very long at the time, but reassuring to hear that, if you plant seeds, they will grow into big oak trees. We're coming towards the end here, and I was just really interested in hearing your take on mentoring, both being mentored, and being a mentor yourself. Can you give us an example of an insight, perhaps from a mentoring relationship that you garnered through your own progression? And what are your thoughts on mentoring in general?
Well, yeah, no, I think it is key, and I think I mean, we're seeing a lot of that certainly within our schools and the universities. The importance of there's mentorship programs, the pairing of individuals come together. There's it's not only in terms of mentoring in terms of methodology, it's mentoring in terms of sort of work-life balance. It's how, and also mentoring in terms of how do you balance a family with respect to this. So mentoring is very broad, and it's almost like it can be almost like life coaching in that relationship. The scope of it, it depends. It's very specific and so on, but it's I mean, this idea of mentoring, like we have this classic version that we have a more senior individual who's hoping is supporting and drawing from their life experiences, supporting a junior investigator. But I think mentoring can come from anywhere, and it can actually be a younger individual who may be helping an older individual realign, retool, and move forward. I think the most profound mentorship that I received was well, actually, and I've met, we prior to this, I mentioned to you, Jane, is my work within the First Nations community in Canada, and I worked with them for 5 years. And in that context, we participated in participatory action research. And the whole notion there was that um, it was based on the work. PAR is kind of like we're pulling from the work of Paulo Freire, where that the interaction of individuals, sort of you create an ethical space, and the interaction of individuals is makes individuals aware of their social, political context, and it's an opportunity for transformation and change for the individual actors. And that type of approach was very popular and preferred within the First Nations community because their traditional view of research for them was that it was colonial and it was exploitive and expropriating sort of knowledge from the communities. PAR they felt was a valued way of engaging in research, but at the same time moving their community forward. So mentoring for me was sitting in those communities, working with those communities, setting aside who I was in terms of representing an individual, and authentically interacting with individuals from those communities, and really the learnings that we applied to the work also applied to my own personal development as an individual. So that's an example how mentoring can take a variety of shapes and forms and isn't necessarily a traditional hierarchical model which the academy kind of describes or kind of parses out for us. It can be expressed in a variety of ways, and also it can be formal and informal. Yeah.
Thank you very much. It's really interesting. It sounds like an absolutely fascinating experience, and one that has certainly stayed with you.
Mm.
And I really like your point there about mentoring and where it can come from. So it isn't this traditional notion, of a senior and a junior, and we have perhaps a lot to learn from a lot of people. Um, we're reaching the end now, and I was just reflecting myself there about some of the themes that have come up, and we've talked about the need to be open. We've talked about the need for patience, the need for trust, the need for transparency. as an underlying principle across collaborations, the need for starting small and taking a long-term view, and being open for opportunities to learn, and also being adaptable as a person. And I suppose don't want anybody sitting in the audience thinking that that's too much of a to-do list. I suppose highlighting the starting small. But would you have a reflection on today's session and your own experience around collaboration, or a parting thought that you would like to leave us with today, Kevin?
Yeah, and I think it really does speak to my experience in the First Nations community. And when I went into those communities, I represented everything that was wrong, coming from the institutions, being male, middle-aged, academic. But what the individuals in those communities say that if you came with an open heart, then you were welcome in our community. So I think it's this notion of an open heart, and I think behind that, if you engage in these activities with an open heart in terms of authentic interaction with these individuals who could be first contact, but can evolve into long-term relationships. So with the foundations of trust, and I think that's key. The some relationships, some of these collaborations are short-term, project specific. But I think it's really important in terms of being open in terms of, to the individuals when you sort of make first contact.
Okay, thank you very much. Um, and it's fascinating, and as I have used that word a lot throughout this webinar, and I suppose to wrap up, then I think in terms of, it's important to value your own time. And I suppose we can see, and it's evident that you value all of the relationships that you have had over the course of your collaborations to date, and will into the future. Um, I'm going to leave it there, Kevin, for our webinar part. I'd like to thank you very much for your time this morning. I'd like to thank Bushra from the Institute in the background helping out. I will say that we're going to have a Q&A session straight away after this. I'm just going to stop the recording. Thank you very much, Kevin.
Oh, you're welcome. My pleasure. Too short.
Exactly. We'll have to do a second one. Super. Thank you.